Welcome. Thank you, everyone. We're going to get started in just a few minutes. Welcome, everyone. Thank you so much for joining us. We are going to get started. Hello, my name is Cathren Cohen, and I am a staff attorney with the UCLA Law Center on Reproductive Health Law and Policy. Thank you so much for joining us today for a vitally important conversation about pregnancy criminalization and the shocking yet predictable outcomes that happen when essential healthcare is banned or criminalized. This webinar comes at an important moment amongst recent reports of women dying because they could not receive timely access to pregnancy care as a result of the current landscape of laws banning and criminalizing abortion. But we also know that pregnancy criminalization takes many forms and that a pattern of misapplication of criminal laws to pregnant people for their pregnancy outcomes or actions was happening long before the Dobbs decision changed the landscape. Today, we have a wonderful panel to discuss this in depth. But before we dive in, we want to share a new resource from the Center on Reproductive Health Law and Policy. Today, we are officially launching a database of statements that we have collected from a wide range of organizations stating their opposition to abortion bans and restrictions on reproductive health care, including wider pregnancy and healthcare criminalization. This database contains 272 statements from groups representing a diverse array of industries, including health, medicine, law, education, labor, social science, and human rights, as well as private businesses, religious groups, and advocates. The breadth of organizations in this database demonstrates the widespread recognition that abortion and pregnancy care are essential and should not be banned or criminalized. We will share the link to this database in the chat, and it's also available. Oh, actually, I'm sorry, this link is incorrect. We'll update that. We'll share the link in the chat. It is our hope that this resource will be useful to advocates and others fighting back against the criminalization of healthcare. As you can see on the screen, the database can be filtered to sort by organization type or industry, as well as geographic focus. And we have included permanent links to ensure that these statements are not lost over time. We have also included a number of joint statements in the database, which is also indicated in the chart and on the webpage. We would like to thank the Collaborative for Gender and Reproductive Equity for funding our work to create this resource. Now, I'd like to turn to our exciting panelists. Joining me today are Michele Coe, Project Manager at Pregnancy Justice, Dr. Michael Belmonte, Assistant Professor of Obstetrics and Gynecology at Penn State, and a former ACOG Darney-Landy Fellow, and Beth Merachnik, Project Director of the Association of Prosecuting Attorneys Addressing Disparities to Reproductive Health Project. Thank you all so much for being here today. And I'm going to pass it first to Michele for a presentation on Pregnancy Justice's recent report, Pregnancy as a Crime, a preliminary report on the first year after Dobbs. Michele?
Thank you so much, Catherine, and thank you so much to everyone for being here. Everyone can see my slides, correct? Okay, perfect. Hi, everybody. My name is Michele Coe. I use she, her pronouns. I'm the project manager of the research team here at Pregnancy Justice. Super happy to be here with all of you today. Thanks so much for taking the time. So Pregnancy Justice is a national legal advocacy organization that defends the civil and human rights of pregnant people. We do this through robust legal defense, strategic policy advocacy, and collaborative effective research like we're presenting today. At Pregnancy Justice, we believe that no one should face pregnancy criminalization. And when we talk about pregnancy criminalization, what we mean is when the state wields a criminal law to render acts associated with pregnancy, pregnancy loss, birth, or associated healthcare the subject of criminal prosecution. This even includes punishing actions during pregnancy that are not otherwise punishable, but become that way because of pregnancy. And pregnancy criminalization is not a new phenomenon, and Pregnancy Justice has been the leader in tracking pregnancy criminalization for decades across the United States. As you can see on this slide, we have data going back to 1973 when Roe was made into law. This includes over 1,800 documented cases of pregnancy criminalization between 1973 and June 2022, the date of the Dobbs ruling that overturned Roe v. Wade. Now, in deep partnership with academic institutions across the country, we're building on this expertise to track pregnancy criminalization in post-Dobbs America. We're excited to share the findings from our report on the first year post-Dobbs, co-authored by our partners, Professors Wendy Bach and Madeline Wasilchek, to set the stage for our conversation today. So before we dive into the key findings, we always like to start with some context. As we know, in overturning Roe, the Dobbs decision invited states to ban abortion across the country by threatening healthcare providers and support networks with criminalization. In post-Dobbs America, we see the chilling effect of those laws and tremendous harms throughout the country, which have resulted in pregnant people being unable to get an abortion and in many instances refuse life-saving medical care. However, another piece of this puzzle is the way that the Dobbs decision emboldened state legislatures, judges, anti-abortion activists, and prosecutors to develop ever more aggressive strategies to protect fetal victims, a concept that's known as fetal personhood. Fetal personhood is an extreme and radical legal concept that fertilized eggs, embryos, and fetuses have the same legal rights and protections as everyone here in this room, and more than the person carrying the pregnancy. Politicians and judges have been laying the groundwork for fetal personhood for decades, and while it was once a more fringe idea, fetal personhood is now actually central to criminalizing conduct and health conditions during pregnancy. This threatens birth, miscarriage, abortion, contraception, IVF, and as you'll hear today, it's not merely symbolic. Fetal personhood carries real and often devastating impacts for the health and liberty of pregnant people and their families. So let's dive into the findings. In tracking pregnancy criminalization, we are focused on pregnant people who are prosecuted and the charges and allegations that are made against them. We found that in the first year post-Dobbs, prosecutors initiated at least 210 cases against individuals for crimes related to their pregnancy, pregnancy loss, or birth. This is the highest number of cases documented by researchers in a single year. So where is this happening? We found that 12 states had at least one pregnancy criminalization case. Alabama alone represents nearly half of those cases, and Oklahoma represents nearly a third. 5 of the 6 states with the highest number of prosecutions have explicitly enshrined that concept of fetal personhood that I was just speaking about. Additionally, it's no accident that some of the states with the highest rates of pregnancy criminalization are the exact same states with the worst maternal infant health outcomes. Now to focus our attention on who this is happening to. In line with recent trends, the majority of people charged in the first year post-Dobbs were low income and white. Yet we know that the criminalization of pregnancy has deep racist patriarchal roots targeting poor Black, Native American, and Latinx women. Pregnancy criminalization originates in the forced pregnancy of enslaved women, passes down through a history of obstetric violence and forced sterilization against women of color, to the legacy of the war on drugs of the 80s, when prosecutors relied on now discredited racist narratives about in utero exposure to crack cocaine to charge predominantly poor Black women with child abuse. In the mid-2000s and into today, drug patterns have shifted, and the target of pregnancy criminalizations reflected these shifts to also include opioids and methamphetamines and the predominantly white communities who use those drugs. As researchers and advocates, we continue to name history, examine shifts in prosecution, and recognize today that people of color continue to be over-policed, criminalize, and experience forced separation from their families and children. So what are pregnant people being charged with? Well, Dobbs certainly unleashed a proliferation of abortion criminalization laws, which, as I mentioned, focused on targeting healthcare providers and helpers. Very few documented prosecutions of pregnant people involve an explicit abortion-related charge. The reason for that is that overwhelmingly, prosecutors actually use child neglect, endangerment, or abuse statutes beyond their original intent to criminalize pregnancy. And that was the case in 198 of 220 charges in our study. So therefore, prosecutors actually don't need criminal abortion laws to prosecute pregnant women. By granting legal rights to fetuses, fetal personhood has paved the way for prosecutors to use existing laws to prosecute pregnant people and strip pregnant people of their rights and personhood. So if we look at pregnancy outcomes of the cases with available information, the majority of cases involve live births. However, it's really significant here that prosecutors criminalized 22 people in a single year who experienced a pregnancy loss. These 22 cases are really harrowing. They often involve pregnancies ending suddenly and tragically, stories of people giving birth alone or losing consciousness. And in some of these cases, people choose to give birth outside a medical setting for fear of criminalization. And this really demonstrates that in a post-Dobbs landscape, we're seeing increased surveillance and suspicion of pregnant women, and especially of pregnancy loss in really dangerous ways. Then when we look a little deeper into the allegations, that are being brought against pregnant people by police and in these court files, we see clearly the way the state controls and punishes behavior, conduct, and healthcare decisions during pregnancy. As has historically been the case, the majority of prosecutions are fueled by a punitive approach to substance use, 203 cases in our study. In one case, police were called to the scene because a pregnant woman was overdosing. After administering Narcan, police charged her with abuse of an unborn child. In another case, an incarcerated pregnant woman, wrote to the judge begging to be transferred to a treatment facility. Her request was denied, and she gave birth in jail. So what we're seeing is, instead of meeting substance use disorder with healthcare and access to treatment and resources, it's being met with stigma, control, and severe punishment, not to mention in the midst of a national opioid crisis. Also striking, as you'll see on the slide, is that in 15 cases, prosecutors argued that pregnant people's failure to obtain prenatal care was evidence of a crime. So pregnant people's lack of access to health care is actually being used against them amidst a maternal health crisis that is one of the worst in the world and disproportionately impacting Black women. So when it comes to abortion, even if pregnant people are largely not being prosecuted at this time for abortion-specific charges, we still see allegations of abortion appear in these cases. That was the case in 5 cases in our study. So as you can see on the screen, pregnant people were alleged to have visited a clinic for abortion, researched through Planned Parenthood, how does the abortion pill work? And although it's maybe not immediately clear at this time how the state intends to use this evidence, this really shows that pregnant people's contemplation of abortion can be weaponized against them in these cases. So how is this happening? As I think many folks on this call know, pregnancy criminalization is often aided by the cooperation of many state actors. And that includes healthcare providers, law enforcement, and family policing system workers. For example, pregnant people are often drug tested without their consent, and the results of those tests are then shared with family policing agencies who proceed to share that information with law enforcement. I think we can all agree here that hospitals should be sites of compassionate and confidential care, and patients should be able to trust their providers without fearing criminalization. So as I wrap up, I'd just like to ground us in the fact that each of these 210 cases represents a pregnant person who is incarcerated or separated from their children, who may have experienced a pregnancy loss, or who had law enforcement called on them when they were seeking health care. The harms and fears of pregnancy criminalization are lived, they are real, and they have rippling and intergenerational impacts for communities and families, lead to worse health outcomes, and only perpetuate cycles of poverty and trauma. In our report, we included a range of recommendations, but for time here today, I'll just end here. I really look forward to hearing from the other speakers and discussing more on the panel. We look forward to working with you to build towards a future where pregnant people are free from criminalization, state violence, and coercion, and have access to the healthcare and support they need to live and thrive. Thank you so much, and I'll pass it back to Catherine.
Thank you so much, Michele, for that very powerful and disturbing presentation and for setting the stage today for our conversation. I'm now going to pass it to Dr. Michael Belmonte to talk about the healthcare provider perspective of this issue.
Hello, everyone. It's an honor to be in community with you all as we discuss the rise of pregnancy criminalization and why it's imperative that we all, in each of our professional and personal capacities, advocate to combat it. As an OB-GYN, I care for patients throughout their lives, performing routine checkups, breast and cervical cancer screenings, and helping patients navigate menopause. I also provide birth control, treat sexually transmitted infections, and help people throughout pregnancy, whether it is their first or if they have other children at home. I support patients experiencing fertility, pregnancy loss, as well as those who need abortion care. I've spent years caring for all of these patients throughout some of the most intimate, personal, and at times complex medical decisions of their lives. As Michele just outlined, while abortion laws have been elevated in the public discourse, pregnancy criminalization is not limited to abortion care, nor is it something new. But it is important to recognize that pregnancy is a highly complex process involving a variety of biological, genetic, and environmental factors. Given this complexity, it's often impossible to pinpoint a single cause for any poor pregnancy outcome. My role is to advocate for my patients' health and well-being. My years of training and practice, as well as medical ethics, help guide how I care for my patients. I often find myself caring for patients as I confirm their pregnancies. Some of these patients knew before I told them. They may have taken a pregnancy test at home or noticed a missed period, breast tenderness, or had significant nausea and vomiting. Others may have irregular periods, other health conditions, or are just trying to survive day to day, and they're shocked by the news. For some, this excitement then turns to sadness. They're nervous that their lack of a prenatal vitamin, their use of alcohol or other substances, or even use of other medications for their other medical conditions may be affecting their growing pregnancy. But for others, they're keenly aware that this information has been used to challenge their fitness to parent. I'm also well aware that some healthcare professionals may not recognize that reporting this information to the state, they then become complicit and central to the process of criminalization. Additionally, following Dobbs, I've had not one, but several patients arrive to my office for care, terrified about what might happen to them when they returned to their home state. They had come seeking abortion care because each of them had made the decision that now was not the right time to be pregnant. Each had spent time saving up money, planning travel, taking time off of work and school, seeking care for their other children, all to flee their state to receive the care they so desperately needed. I had to be the one that told them that they were not actually pregnant. Their reply was always the same. I was too afraid to take a pregnancy test. Too afraid because they feared how it could be used against them. This scenario is just one that illustrates how the threat of criminalization creates a chilling effect, where patients may fear seeking care, especially if they believe their health outcomes might be scrutinized or criminalized. But I find myself encountering more and more people who confide in me these very real fears. It is also important to recognize that criminalizing pregnancy outcomes disproportionately impacts marginalized groups, including those with low socioeconomic status, people of color, and those in rural or underserved areas. For healthcare professionals like me, this situation presents a moral and legal dilemma. We are trained to provide care based on the medical needs of the patient in front of us, not based on fear of criminal liability. Laws that criminalize pregnancy outcomes undermine the trust between patient and provider. When pregnancy outcomes are criminalized, the consequences for patients can be devastating. While my examples touched upon those who were afraid of seeking care and fear being shamed, the role of stigma in these scenarios also push people who need the most support away from the resources that can help. This doesn't just affect individual patients either. It has wide-reaching implications for public health. Restricting access to abortion and criminalizing certain pregnancy outcomes can increase the risks to parental and child health, as delaying or avoiding care can also lead to worse health outcomes. I want to emphasize that as a physician, I am absolutely certain that criminalization is not the solution to challenges that pregnancy and reproductive health present. Instead, we need to focus on compassionate, evidence-based care that prioritizes the health and autonomy of the pregnant person. Criminalizing pregnancy outcomes undermines the trust, safety, and medical integrity that should exist between a patient and a healthcare provider. We must continue to advocate for policies that support patients' rights, provide equitable healthcare, and protect the health and well-being of all individuals, especially during the critical time of pregnancy. Thank you. And with that, I will pass it back to Catherine.
Thank you so much, Michael. And I am now going to pass it to Beth for her presentation.
Thank you very much, Catherine. We've got a couple of slides. Good morning or good afternoon, everyone. Thank you so much for joining today's webinar. We're really glad that you could join us. First, again, my name is Beth Merachnik. I'm a project director here in Washington, D.C. at the Association of Prosecuting Attorneys. And on behalf of APA, I want to thank you, Catherine, and the Center for inviting us to present and join this very important webinar, along with Dr. Michael Belmonte of ACOG and Michele of Pregnancy Justice. I first want to let folks know a little bit about APA. If you're unfamiliar with us, we are a national nonprofit, and our organization, or I should say our association, acts as a global forum for the exchange of ideas, allowing prosecutors to collaborate with all criminal justice partners, conducting timely and effective technical assistance, and providing access to technology for the enhancement of the prosecution function. Very briefly, we're guided by a board and our major counties prosecution council, which includes elected and appointed prosecutors from 40 of the most populous jurisdictions from across the country. In addition to that, our staff here at APA, we are composed of former prosecutors, again, from across the country. So for more information about our association and the different areas that we work on, please visit our website at apainc.org. One of our areas of focus right now is addressing disparities to reproductive health. And as you see here, we are funded by the Collaborative for Gender and Reproductive Equity. We are about to, next month, enter into our 4th year of our focus on this area. So we've been involved in it now for a number of years. And what the association does, our main goals are to provide education and resources to prosecutors about the medicine, the science, the evidence-based research of reproductive health, including abortion, and the disparate impact of laws that severely restrict or ban access to abortion. We provide and host educational forums and webinars on a whole host of different topics. Our reproductive health webpage houses a number of public health information, data, medical information, again, research, and we have a special platform that can provide information about the current status of state abortion laws, shield laws, codes, and recent case decisions. We also will we also work on developing and submitting amicus briefs in certain state cases to promote the access to reproductive health and abortion. I've mentioned webinars. We have current resources on our webpage, and as I said, educational forums. And the purpose is, as most people here know, prosecutors exercise discretion on individual cases. We do that in all the work that we do. And as most people know, prosecutors have the authority to charge or not to charge a case. And when considerations for that are done, there are many factors that come into play for those decisions. The purpose of our work really is to ensure that prosecutors have all the evidence-based research, data, medical information that they need so that they have all the tools for any reproductive health investigation or case they may encounter. And these tools include working with experts and evaluating medical opinions and recommendations when exercising that discretion. So I just really want to emphasize that where we are at this point in time, really the medicine and the research is critical to understanding what the current landscape looks like, and also to be able to make that information available to prosecutors so that they can make well-informed decisions. This has not been an area we have been traditionally involved in, but now that we are, based on state laws that have been recently enacted, it's very important that prosecutors have all the resources that they need to make those well-informed decisions. So with that, April, if you could just give the next slide. If you'd like to learn more about our project, here is our website information, our contact information. We can provide information, resources, technical assistance, as well as connect prosecutors with all different types of experts so that they have all the information that they need. And with that, I'm going to turn it back to you, Catherine. Thank you.
Thank you so much to Beth and to all of our panelists for your very thought-provoking presentations. We are now going to move into a kind of group discussion. I would like to invite everybody who is in attendance to share any questions you might have for our panelists today in the Q&A feature on Zoom, and I will get us started. So this conversation is unique in that it brings together organizations representing different professions and demonstrates that you all share values that are grounded in your profession's ethical and professional duties, and that criminalization of pregnancy and abortion conflicts with these values and ethical duties. In this moment, can you speak to why it is important to work across disciplines to oppose criminalization? And if you have any examples of successes in sort of interdisciplinary efforts like this, we would love to hear them. I can let you jump in, or I can hand it off to someone if anyone feels strongly. Michael, I was going to maybe turn to you to start, if that's all right.
That's perfect. So I think certainly when I think about medicine, the first thing that comes to mind is a physician in a room with the patient in front of them. And so certainly we are well versed in advocating for our patient in that clinical setting. But I think when we see these trends, it's hard to make a difference within your system. And so finding people that can collaborate with you to make that impact larger is only more and more important. And so when we're thinking about why we're all here today, it's important that we work with our partners in all different fields so that they're not only aware of the issue, but we can actually make positive change for everyone.
And I would just, to follow up on what Michael said, I would just add, I think from the prosecution perspective, that's why the medical education, information, opinions, research that comes out is so important for us because of that medical legal connection now. It's so important for us to be able to speak with one another, to share information so that we're all well informed and we understand how kind of each of our pathways are functioning at this time. So we are certainly grateful for the information that ACOG has provided for us in the past, as well as training and education from Pregnancy Justice as well. It's a way that we can act as a conduit to share that information and inform the prosecution field, which, as I said earlier, may not be aware of all the information and science and medicine that is out there as it relates to this issue.
Thanks so much. And I can just add from our research perspective, we're working on a 3-year study looking at pregnancy criminalization in the 3 years post-obs. And in embarking on this sort of longer study, doing interdisciplinary work has been so critical. If we think about just a pregnant person who's facing criminalization and how many systems they're actually moving through, right? Healthcare, criminal legal, family policing. It's so important if we're actually going to understand the scope and scale of the problem to be working with folks in all of those disciplines. So I'm really proud of our research team that has, law professors and legal scholars, but we also have public health scientists, we have sociologists, and at Pregnancy Justice, we also really value being in deep communication and collaboration with our movement partners on the state level and the local level. So yeah, just really taking that interdisciplinary lens to make sure that we're working together to, find the solutions and understand the problem together.
I'll bring this full circle if you don't mind, but
Would
the
love.
other thing that I would love to chime in is why we're all here today is to talk about this and make sure that everyone is aware of it. And so you can find creative ways to partner with us as well in ways that we may not be aware of. And then ultimately ensuring that the general public is aware of these trends as well, so that they can advocate on a personal and local level for people within their communities.
Great, thank you all so much. My next question is about research and about the great research that Pregnancy Justice has done and kind of how you hope that is used by advocates and people in other fields. I'll start with that. Then we also have a question in the chat of what research is needed. And so I'll open that up to the broader group as well. But Michele, first, if you want us to talk about how do you hope that your research and your ongoing work will be used by advocates and by folks from the professions represented today?
Absolutely. Yeah, it's really our dream that our research is directly translated into action and that it's used by advocates. As a former advocate, I'm always trying to just, empower state and local advocates with the information and the data that they need to really move towards their policy solutions. I was thinking an example we might share is that in our last report, we had state fact sheets for Alabama, Oklahoma, and South Carolina, and we hope to produce similar fact sheets throughout the next several years. And these fact sheets we've seen sort of direct use with state advocates where they've used their fact sheets to better understand prosecutions by county, to better understand what kind of community level efforts do they need to concentrate in different counties across their state. state to understand sort of the breakdown of allegations and charges that are happening within their state. And so we're always trying to find, really local state-based resources for our advocates that we partner with. And then I'll also just say, as I mentioned, Pregnancy Justice has a legal advocacy team. The criminal defense is a huge part of our work, and our research is always informing that work. And so we're making sure that our legal strategy is really, informed by a data-driven approach through our research. And so thank you everyone for being on this call. Please feel free to reach out to me if there are any partnerships or ways that our research could be useful, because that's really why we do it. That's part of the dream. So yeah, thanks for that question.
Of course. And Beth and Michael, could you speak to kind of the usefulness of this kind of research for your own efforts, or alternatively, if there are existing gaps in reproductive health research that are most needed right now for your work?
I'm happy to jump in on that. We are always interested in the research that's coming out as it relates to the public health data. Especially we look a lot at the public health data and the evaluations of that data now with a post-obs lens, so that we can provide that information both on our webpage and to the field, so that prosecutors understand what the impact of the Dobbs decision has had on reproductive health, and specifically as we focus on abortion, what that means for the prosecution field, and certainly, as prosecutors deal with victims in a whole variety of cases, what that impact is as well. So for us, we're always very interested and trying to keep up to date on all the, excellent research that has been done even pre-Dobbs, and now what we see coming out post-Dobbs as we begin to collect the data and begin to have some evaluation, especially the first year post-Dobbs.
And I think from our perspective as clinicians, the kind of medical science and public health research is what allows us to then develop ways to make outcomes better for all of us. And I think certainly from a professional organization level as well, that is how we can craft clinical guidelines for all physicians across this country, so that we are always providing the best care for the patients in front of us.
And I'd just like to add, Catherine, too, just to follow up on what Michael said. The medicine is so important here for prosecutors to understand. I know we're talking research, which is a larger topic, but specifically to drilling down on the medicine and what the doctors are seeing in their day-to-day practice. This is information that is important for us to make prosecutors aware of as well. Again, that medical legal piece.
On a similar point, thank you, to that medical legal piece, I wanted to ask, Michele presented, and we've seen other research showing that often pregnancy criminalization begins with healthcare providers or people working in hospital settings being the ones who sort of initiate that criminalization process. And we've spoken in the past about, needing to share information across these industries to prevent that. I wanted to open to all of you. What can we do to disrupt that pattern of pregnancy criminalization? And what information do you, Beth, as the prosecutor perspective, wish that healthcare providers had, and vice versa, Michael, as healthcare providers, wish that prosecutors knew on how that reporting is unnecessary and harmful?
Well, again, I guess from the prosecution perspective, in terms of what healthcare providers, I think it's important that they understand, from the prosecution standpoint, it's important to educate the prosecution field, which is one of the goals of our project, and also to understand, the exercises of prosecutorial discretion and what that involves. I mean, to that end, we have developed and worked on a statement and a policy brief as it relates to the independence of the prosecutor and prosecutor discretion, what it is, what the historical basis is, and why it's important, and how prosecutors make those decisions. So I think that is the type of information that would be important for a healthcare provider to understand and to know about from how a prosecutor functions day to day if they are confronted with an investigation or case as it relates to reproductive health, specifically looking at abortion.
I think from my perspective, I find that many providers ask questions that are not clinically relevant and don't provide them the information that they need to safely take care of the patient in front of them. And to some extent, that can be helpful in creating rapport and really getting to know your patient. But in these settings, generally, it's just information that ultimately can then be used against the patient. And so I think when we are thinking about these issues, it's really important that patients should not be forced into answering questions that they don't feel comfortable answering. We should not be documenting information that is not clinically relevant to the care of the patient, because ultimately, as you had mentioned, we end up being the ones that are central to this criminalization process. I think it's also important to recognize that certainly when we are the ones disclosing this information to law enforcement, especially when there's no obligation to do so, that's certainly a violation of HIPAA and patient healthcare relationships. So we really need to be thoughtful about how we go into these clinical scenarios. And I think having these conversations and building these relationships helps us to recognize our role in this system.
Yeah, and I would just add very briefly onto that at Pregnancy Justice, we have a Confronting Pregnancy Criminalization guide on our website, which I'll share with Catherine to share to the group, but that link, but it really reiterates what Michael said, is just knowing the laws in your state and understanding and educating others about the impact that healthcare providers have in this sort of pathway to criminalization. So I'll share that right now.
Thank you so much, Michele. And I also wanted to ask you, you spoke about the large number of incidents of pregnancy criminalization that were related to drug testing and substance use. And I was wondering if you could speak a little bit about that impact and if you have any suggestions for disrupting that as well.
Yeah, absolutely. Thanks for that question. Yeah, I think that we see, like I mentioned in my presentation, we'll see drug testing happening, sometimes without the consent of the patient, and then just really the intersection of these systems. So then seeing that drug test then being sent to the family policing system, and then that, to law enforcement. So it's really sort of that multi-prong that really then initiates the case in some cases. Something I'll add is something that we're really, I saw there was a question about taking action, and we have a lot of recommendations in the report, but one of them is really thinking about this exact issue, seeing what are state laws where we can improve informed consent. Are there laws where we can improve, mandatory reporting laws? We've looked at laws to kind of raise the threshold of that reporting pipeline, right? So making sure it's not just a positive tox equals share the test, right? Are there sort of these little ways we can intervene on state law to kind of disrupt that pipeline? And that's something we're working through as an organization as we continue our state work, and are always happy to connect with folks on this call about how to be most strategic in that area.
Thank you so much. We have a couple questions in the chat going to some points that all of you made about the disparate impact of pregnancy criminalization on already marginalized populations or groups that are already facing difficulty accessing healthcare or are more likely to be criminalized in general. For all of the panelists, can you speak about the specific needs or the impacts that these issues have for immigrants, migrant workers, and refugees? And we also have a similar question about adolescents. Michael, yeah, I saw you nodding your head.
Yeah. So I think from my perspective, you're already dealing with, as was mentioned in the question, a group of people who are already significantly marginalized in the United States and to some extent live in daily fear of how they interact with the legal system and what that could mean for their families' lives. And so, certainly from the healthcare perspective, I think it's important for us to once again focus on what is clinically relevant and really create a open and compassionate space that takes into account all of these things while essentially placing us in a position where we are safe for these patients and that we will take care of them to the best of our ability with the resources that we have and not lead them into this carceral system.
And Beth, just a slightly different version of this question. The question in the chat is about what information do prosecutors or others need to support safe access to reproductive health care, including contraception, abortion, and pregnancy care for adolescents? And are there any sort of gaps in research or knowledge that would be useful for prosecutors to support this access?
I would, I think again, at this point in time, looking at the research post-Dobbs in terms of what we're seeing for access is going to be very important information to share with the prosecution field. Again, juveniles, when we talk about communities that have typically been marginalized, what we're seeing in since June of 2022 and the data that's coming out from that, I think is very important for prosecutors to know. We do provide information, obviously, on the wealth of information that has been published in this area. But again, I think looking at the data since Dobbs is important. We look at maternal mortality, infant mortality. We're seeing new studies that are coming out as it relates to both of those, and the disparities in terms of maternal mortality as it relates to Black women. I think is really, really important for the prosecution field to know about and to understand, because again, this has not been an area that traditionally prosecutors have been involved in this public health arena. And so I think, again, that is very, very important and really was part of the impetus for us to begin this project was the disparate impact on access to reproductive health.
Thank you so much. I think we have time for one or two more questions from the chat. We have a great question in the chat about, we've been speaking kind of generally about opposing efforts to criminalize the pregnant person, but also what about parallel efforts to protect healthcare providers from criminalization? Open to anybody, but either Beth, I'd love to hear about the way that this is involved in your project's work. Michele, how those are demonstrated in your research as well, and Michael, your perspective as a healthcare provider.
Well, I can certainly tell you that is very important, is to protecting reproductive health workers. clinics. We do have a federal FACE Act, and many states, no, a number of states have state FACE Acts as well. We just put on a webinar last month that's available on our website as it relates to the FACE Act. I think it's very important for people to know about it and to understand what not only what it is legally, what the elements are legally, but even to let law enforcement know if there are any incidents rising to that level by threats, harassment, or more violent episodes, that local law enforcement is involved, as well as the federal law enforcement, and there's a whole connection there. So we have a lot more information on that. I think that's number one for reproductive health workers and clinicians to know about, and to avail themselves of where they need to call if they're faced with something along those lines.
Yeah, oh, no, go ahead.
Nope, I was just going to say other thoughts from our panelists. Thank you, Michele.
Oh, okay. I was just going to say, yeah, thank you so much for this question. Our research is primarily focused on pregnant people who are being prosecuted. However, we're in deep partnership with organizations in the reproductive health rights and justice movement that are focused on providers. In our report, we cite to a number of studies that have recently come out around the way, abortion laws are impacting and criminalizing healthcare providers. I would also say that, in thinking about where folks are being prosecuted, we're trying to better understand how that relates to the access to reproductive health care in that county, in that state where that prosecution is happening. And of course, a huge part of that is what providers are there or not there because of the laws that are, preventing them from practicing in that state or in that county. So while it might, healthcare providers might not be the direct population that we're looking at in our research, it's tremendously important to us. We work with a lot of providers, and we do want to make that part of the larger conversation on this issue.
And from our perspective, certainly I've had the pleasure of speaking to many physicians across the country, and quite frankly, people are very afraid, just like the patients that we take care of. And so I think, like we've been talking about throughout this presentation, I do think that there's power in numbers. And so I think efforts to connect with the local prosecutor's office or other defense attorney organizations that can help us understand the law, because we are not lawyers, and understand how we can best protect ourselves. I think both on a local and regional and even national levels, I think will be imperative, particularly as we continue to face evolving laws throughout the country.
Great, thank you all so much. I am cognizant that we are coming up on the end of the hour. I wanted to give each of you a chance to just briefly, if you have any final thoughts or calls to action or resources you'd like to share, no need, but if you want to have any sort of closing thoughts.
I would just say thank you all so much. Feel free to reach out directly. We love meeting with and connecting with more folks in this work. We publish our report. More reports to come, more data that folks can be using and tools. And so please feel free to reach out. But thank you all so much. I know it's such a busy and hectic time. We really appreciate you taking time to join this webinar.
And I'll just echo that Michelle's sentiment. Yes, thank you so much for joining us this afternoon for this important webinar. Again, on behalf of the association, we're we were really thrilled to be invited to join in on such an important and critical topic at this time. I know there's a question. If anybody has questions on the FACE Act, the last piece I just talked about, which is the federal access to reproductive health services, the law. Contact us at APA and we can point you out with more resources and give you potential access to the information that we provided last month. But it is very, very important that folks know about any state law if you're in a state that has a state FACE Act or federally. And I also want to say we will continue to provide education, resources, assistance to prosecutors in the field and collaborate with our partners to provide the important information concerning the medicine, the science, the research, public health data, and the disparities that are occurring as a result of these abortion restrictions and bans. Thank you very much, Catherine, for inviting us.
And then I just wanted to mention a couple of things, but as Michele had mentioned her resources, I also wanted to plug the new guidelines from the American College of Obstetricians and Gynecologists regarding self-managed abortion that I think really does a nice job at speaking to the best recommendations for us as healthcare providers and really does a deep dive in how best to handle these situations. And with that, I would urge all of you on the call to interact with your professional organizations to see how you can also get involved in this work because we need partners from every field. So thank you all.
Thank you all so much for your presentations, for being part of this discussion, and for your broader work in this area. We had a couple of questions about connecting and resources that you all just touched upon. We will be in touch with all of our panelists for the requests to connect from people in the chat. And also there was a question about the links that were shared in the chat during this presentation. We will make sure to include all of those and send them out with the Zoom recording when we send around the recording from today's presentation. To Michael's point of continuing connections and sharing with your professional organizations, we will put in the chat one more time the database that UCLA has put together. We have on that page a form to submit if you are part of a professional organization that has made a statement like this. We are allowing and we're welcoming the collection of additional statements to add to this database. And so we would love to hear from you on that part as well. So thank you again to all of our panelists and to all of you in attendance for coming today for this very important conversation. We hope that all of this information and the database will be useful tools for all of you in your efforts to resist and fight back against pregnancy criminalization. We'd like to thank again our funder, CGRE, for sponsoring this very important work, and all of you for caring about this very important issue. So we hope everyone has a wonderful day. Thank you again for joining us. And we will be in touch in the future with further resources for this issue. Thank you, everyone.
Thank you.
Thank you.
Bye, everyone.
Bye.
Okay, chat is saved. I think that's all we need.
Excellent. Thank you.